I'm Rick Harp. This is your APTN News Brief for Friday, February 2nd. We begin once more with the Saskatchewan inquest into the 2022 mass stabbings on James Smith Cree Nation and nearby Weldon. And last night, members of the jury provided their recommendations. Rachel May reports.
Daryl Burns lost his sister Gloria in the attacks on September 4th, 2022. He said that this inquest provided an opportunity to honor those who lost their lives.
So if my sister's death means that something positive is going to come out of this, then her legacy is going to live on.
After 2.5 weeks of testimony and 2 days of deliberations, there were a total of 29 recommendations made, 14 from the jury and 15 from the presiding coroner. 4 groups received recommendations from the jury. At the top of the list, the Correctional Services of Canada. They were asked to provide 1 consistent support worker per inmate, as opposed to multiple support workers for 1 inmate. One of the main recommendations for James Smith Cree Nation was they should establish their own police force. For the RCMP, they need to have the photos in their database stamped prominently with the date the photo was taken. The final group given recommendations from the jury was the Federal Ministry of Public Safety. They were encouraged to make a more efficient alert system available across Canada whenever dangerous offenders are on the loose. Presiding coroner Blaine Bevan had 15 recommendations of his own. For the RCMP, he recommends meeting with James Smith leadership regularly. For James Smith leadership, he recommends that they let the community know when someone is unlawfully at large. Bevan also said the Correctional Services of Canada has to improve the way it releases offenders back into the community once a sentence is served. Clive Wayhill is the chief coroner of Saskatchewan.
We've had some inquests as high as 20 recommendations. Since I've been the chief coroner, this is certainly the largest amount of recommendations we've had at any inquest.
Saskatchewan RCMP Commanding Officer Rhonda Blackmore says that the force will be working to address the concerns.
We're going to look at all of those recommendations, I think, because there is a lot of positivity that can come out of those recommendations.
Wayhill says that his office will let the public know when and how the recommendations are being addressed, a process that can take between 3 and 6 months. Rachel May, APTN National News, Melfort, Saskatchewan.
To Nunavut, where the special interlocutor on missing children and unmarked graves just wrapped up her northern gathering. Trevor Wright has more.
This week, the special interlocutor, Kimberly Murray, connected to Inuit survivors of residential schools. It's the first such gathering on unmarked graves in the Arctic. It's also the last, as Murray's mandate ends in June of this year, with time needed to make recommendations based on these gatherings. Navlik Tologanek was born in Cambridge Bay. She was sent to Stringer Hall, Inuvuk's residential school. She says a specifically Inuit gathering is needed.
Well, for myself, like I spoke and asked questions about if we can have another Inuit gathering, specifically Inuit and elders and survivors gathering in Nunavut, because like I said earlier, there's not enough of our elders here, survivors.
In addition to residential schools, an estimated 5,000 Inuit were sent down south to tuberculosis sanatoriums in the 50s and 60s, following a similar trend of long-term removals without word or warning to families. Families were not informed when someone died. A lack of records or contact is a long-standing issue with many Inuit survivors.
I think the government likes to hide things, hide files, hide names, hide their bad doings of what they're not supposed to be doing, or otherwise it's just genocide. I don't know. I don't want that to happen to my kids or my family anymore, and I want to stop it.
Murray says the Inuit experience will be taken into account on her recommendations.
We recognize that each of our gatherings are unique, and certainly it's very unique being in the north, and the experience of Inuit with the hostel system, with the TB sanatoriums is quite unique to Inuit, and so there has to be unique responses to address the challenges that they're facing.
There were 21 TB facilities that operated across Canada and 14 residential schools in what became Nunavut. According to the final report of the Truth and Reconciliation Commission, an estimated 15 children died in Nunavut residential schools. However, due to limitations on records, the number is expected to be higher. Trevor Wright, APTN National News, Iqaluit.
Alberta's newly announced policy on the rights of transgender youth has faced some immediate pushback. And on Thursday, outgoing Alberta NDP leader Rachel Notley, plus some new Democrat MPs, held a joint press conference to share their concerns. Fraser Needham reports.
Alberta NDP leader Rachel Notley says the provincial government is restricting the medical rights of one of society's most marginalized groups.
I'm so deeply, deeply concerned for what this means for transgendered and other marginalized youth within the queer community. We know that that houseless children disproportionately come from those communities because the relationships with their families have broken down.
Smith made the policy announcement on social media on Wednesday. Among the new changes, Alberta will ban gender reassignment surgeries for youth under 18 years old, prevent hormone therapy for the purpose of gender affirmation for children under age 16, and require parental consent for preferred name and pronouns for students under 16.
And we know exactly the outcomes of these kinds of programs when young people are targeted.
Edmonton NDP MP Blake Desjardins, who is the first member of Parliament to publicly identify as Two-Spirit, says the policy changes are draconian.
The outcomes of these programs are horrific, whether it's the program that tells them their identity isn't real, or if it's the program that tells them that they ought not to exist in these spaces. This continues in that tradition.
James McCocus is a family doctor from the Saddle Lake Cree Nation in Alberta, who also identifies as Two-Spirit. McCocus works directly with trans patients and says pursuing a gender-affirming path is not one that is made without a lot of thought, whether the patient is young or old.
It's really important to know that people don't do this lightly. It's something that they've known their entire life. And clinicians do thorough assessments of ensuring that, people, when they say they're trans, they're trans. And we just ensure that there's no medical contraindications to doing so. And there is a thorough assessment process of that.
He says regardless of how the Alberta policy change shakes out, it won't change the work he does.
I will continue to practice trans and gender-affirming care on the reserve in a place where we have our own jurisdiction and continue to prescribe these life-saving medications that absolutely make a difference.
Fraser Needham, APTN National News, Ottawa.
The Manitoba government has announced $800,000 in new funding for Indigenous youth mental health. Dedicated to community-based programs over the next 3 years, some $500,000 of those new funds is earmarked for the Indigenous Youth Mentorship Program, where university and high school students manage weekly after-school health and culture programming. It features physical activity through traditional Indigenous games and nutrition and diabetes prevention. And of the 24 new sites, 15 will be in northern and rural areas across the province. And finally, Manitoba's Advocate for Children and Youth has just released their annual government compliance report. And as we'll hear from Sav Jonesa, the report on children's rights found progress on some recommendations with no movement for years on others.
How is the Manitoba government ensuring children's rights in the province? That's a question answered by a new compliance report by the Manitoba Advocate for Children and Youth, also known as MACY. It looks at the ways the provincial government has progressed implementing recommendations made by MACY since 2018.
Since the Advocate for Children and Youth Act came into force in 2018, MACY has released 12 special reports in which a total of 80 recommendations have been issued to address pressing children's issues, rights, concerns in Manitoba.
Recommendations cover areas like education, mental health, and justice. Manitoba Advocate for Children and Youth, Sherry Gott, says this year saw some encouraging results.
We found that overall compliance with recommendations has improved since the last monitoring cycle and generally over the last 4 years. 32% of the recommendations that have been assessed are now fully complete. 75% of the recommendations now have a positive or mid-level assessment, which is an increase of 15% from last year. 98.5% of the recommendations now have demonstrated actions toward their implementation.
Though progress has been made, Gott points out that isn't true for all recommendations. She says 48% of all recommendations being assessed for the second, third, or fourth time have recorded no progress. These include recommendations for a long-term residential mental health treatment center for youth and developing anti-racist education initiatives in schools, as well as multiple recommendations for disability services. With the new NDP provincial government taking office after the assessment period, Gott says only time will tell how they will measure up against the previous government's compliance.
While it's too early to review the progress of the current government, we look forward to working with them in a collaborative manner.
Sav Jonza, APTN National News, Winnipeg.
And that's your APTN News Brief for Friday, February 2nd. I'm Rick Harp.